Welcome to the Virtual Venture Cafe, everyone, and a very special welcome to our first-time community members. Tonight is our annual conference, Digital Health, presented by Sampo Digital Lab. Venture Cafe is a nonprofit organization, and we rely on our corporate partners, innovators like Sampo Digital Lab, to present all of our content free of charge. Tonight we have a bunch of great webinars and virtual meetings discussing an important issue, which is healthcare and digital integration. And with this, let me introduce our great panel. So we have Vinit Nijhawan. He has over 30 years of experience building startups. He served as CEO of 3 of them, and 5 of them were acquired. Vinit is an advisor and board member to several technology startups. He was a Mass High-Tech All-Star in 2005. Vinit holds 2 significant high-tech patents, each forming the cornerstone of a startup company. Welcome, Vinit. Joining Vinit tonight is Naomi, a founder and CEO of Health Innovation Strategies, a consulting firm specializing in innovation and digital health. She advises pharma companies, providers, and program design and digital health strategy. Joining Vinit and Naomi today is Zeaske, a partner at Echo Health Ventures in Boston, where she identifies and invests in healthcare companies that create paths for innovation in the complex healthcare industry. She builds deep, high-value relationships with portfolio companies, leveraging her 2 decades of experience bringing emerging models and technology to market. So welcome, Naomi, Jessica, and Vinit, and over to you, Vinit.
Thank you, Yulia. Hello, everybody. Another virtual Zoom. I think all of you are sort of groaning as we sit through this, especially with this beautiful day outside. But I think you're going to find this very exciting. We've got a bunch of good panelists here, and we're, discussing a very timely topic, digital health. And it's an area of healthcare that's always had promise, but this pandemic has suddenly shot it to the forefront in many areas, and the panelists are going to discuss that. So I'm going to start it off with sort of a quick slide presentation, a little food for thought. I think Naomi's going to have some slides, and then we're going to move into Fireside chat session with Naomi and Jessica. Please send your questions via the chat function, and I'll try to keep track of them and pose the appropriate ones to the panelists. So I am going to just share my screen, and if I can find the right thing, here we go. So the title is Health, the Future is Digital, and it's another Venture Cafe virtual event. This is the second one I've done, and Yulia and team do a fabulous job. So the only problem is my slides are getting blocked, but here we go. Just one second. So, everybody knows that the US by far spends more in absolute dollars as well as percentage of GDP on healthcare expenditures. And, as you can see from this slide, the government portion of it is pretty significant. As I said, we by far spend more per capita than any other Western country. One second. However, despite all this expenditures, we're the least efficient at how we conduct healthcare. So if you look at all different kinds of metrics here, I'm showing a couple where, preventable deaths per 100K people, the US is number 1, and others have sort of improved. We've improved as well, but not as much as other people have. And then the administrative cost of our healthcare spend as a percentage of total is very high. And there are many reasons for this. one common theme amongst all the others that are on this chart. All those other countries have single payer systems of one kind or the other. And what does that what is that spent on? As you can see, that much of it is spent on chronic disease management. And again, this is something we all know. But as you can see from these charts, rising obesity is one of the reasons that we're seeing sort of a huge growth in hypertension, diabetes, and other related chronic diseases. And it's not just, our physical health, our mental health is also suffering, especially as we, go spend more of our time online. And as you can see, there are a number of positive things from social media platforms, but there are also many negative aspects of social media. And it's interesting, we're all talking about infectious diseases, and when we think infectious disease, we really think about viruses or bacterial infections. But there are social infectious diseases too, such as suicide and other such things. And those are exacerbated by social media. So can digital health help? A lot of investment is going into digital health companies. This is kind of a global view of 39 healthcare unicorns. These are private companies worth over $1 billion. And as you can see here, North America is the leader in sort of these venture-backed companies. Amount of venture capital going into digital health companies has increased considerably. It's doubled since 2015. It's flattened out a bit, but it's still a considerable amount of investment. This is in billions of dollars. And these are sort of the most prolific investors in digital health. A couple of them are accelerator-like investors, such as 500 startups and plug and play. But then there are others that are, Series A through Series C investors like F Prime Capital and Bessemer. And then, I always find this a little bit interesting. If you follow where patents are being issued, that gives you a bit of an indication of what's coming a few years in the future. And here's a view of patents filed for AI in healthcare, which is a component of digital health. And as you can see, most of the AI in healthcare patents are in disease diagnosis and prognosis. And many of those sort of are addressing, a big problem in our healthcare system that Eric Topol's sort of written about in his book called Deep Health. And that is that a lot of the expenditures occur because of misdiagnosis. And, if we diagnosed ailments in a more accurate way, there would be a lot less unnecessary healthcare spend. And AI is an area that can help. And that's it for my presentation. A little food for thought, as I said. Naomi, do you want to put up your presentation?
Sure. And let me just see if I can get it going. Do you see the slide there?
Yep.
Okay, great. Well, good afternoon, everyone. Again, my name is Naomi Freed. I want to thank the Venture Cafe and sponsors for the opportunity to participate in this digital health conference today. And thank you, Vinit, for that great overview of really the importance of digital health and the growing investment that we're seeing and the many problems we have in healthcare that digital health can help us with. I think the future of healthcare is digital, and I think in a lot of ways that future has arrived. As someone once said, it's just not evenly distributed. And when it comes to digital health, I would say that COVID-19 has really been a catalyst, an accelerant driving digital health adoption forward. So I'd like today to briefly speak about what digital health is, sort of double click on this term that we're hearing a lot, and then think about a way to potentially organize this exploding field. And I'll share some examples that are particularly relevant because of the coronavirus pandemic. Just to introduce myself a little bit more, I founded Health Innovation Strategies several years ago to take advantage of my experience running innovation programs for provider and pharma. I was the first Vice President of Innovation and Advanced Technology at Kaiser Permanente, the first Chief Innovation Officer at Boston Children's Hospital, where I built the Innovation Acceleration Program and the Digital Health Accelerator there. And I then moved to Biogen as the Vice President of Innovation and External Partnerships to really focus on innovation beyond the molecule. Today, I share my experience in digital health as the CEO of Health Innovation Strategies. We are a boutique advisory firm. We are focused on digital health strategy and innovation program design and optimization for large healthcare organizations. And we work a lot with pharma and with providers on their digital health strategy and innovation programs. So let's talk about what digital health actually is. It's a term that gets thrown around a lot, applied to a lot of things, not all of which I would argue are digital health. So I'd like to propose a working definition that I think has been resonating with the pharma and providers that I've been consulting with. So digital health leverages technology, hardware and software to deliver care and information to patients and providers that can be more convenient, more cost-effective, and personalized. And in terms of the software that digital health leverages, apps, computer programs, games, virtual reality, chatbots, and hardware, well, clearly computers, mobile phones, tablets, also sensors and wearables, robots and monitors and devices, a lot of hardware and software. I think what's exciting about digital health is it has the potential to improve outcomes, decrease costs, and actually deliver care and information in entirely new ways that aren't possible when we're not in the digital world. So digital health is a massive growing field, more and more investment, as Vinit just shared with us. So I think it's useful to have an organizing framework, particularly for looking at digital health that impacts patients. So I'd like to propose sort of 4 areas within digital patient care. The first one is clinical grade digital information. The second is digiceuticals. The third is medication adherence. And the fourth is virtual patient care. And I'd like to take a minute to define and share an example that's sort of COVID related in each of these areas. So the first category is patient-facing digital health solutions, is clinical grade digital information. And this is information that's collected from or about patients that's actually clinically actionable, and it can be used to help track or diagnose diseases. So the Australian company ResApp has developed an app that can diagnose pneumonia using the microphone on a smartphone to collect and analyze cough sounds. If you can get over the sort of the ick factor of having your child cough on your phone, this is a great way to diagnose pneumonia in kids without anyone having to leave their house. ResApp has EMA approval to diagnose respiratory diseases in both adults and children. And today in Australia, ResApp is being used by doctors to do remote triage for patients who present with a cough, and they differentiate whether that cough is a result of pneumonia, asthma, COPD, or COVID-19. And all of this is done virtually, which is great, which keeps people from having to go to the hospital to find out if they have COVID-19. So beyond clinical grade digital information, there are also digiceuticals, and these are digital health solutions that actually are offering a treatment. These are tools that treat or modify a condition. They're therapies that are digital in nature. So, job loss, quarantine, increased stress resulting from the coronavirus has led to a significant increase in mental illness. And it's estimated that right now, about a third of Americans may be suffering from depression. Therapists are pretty overwhelmed, but there are digiceuticals that actually can help with depression. These are digital therapies. For example, the German company Gaia has developed a digital therapy to treat depression. And the data from their 14 clinical trials with thousands of patients has shown that their digital intervention is as effective as drugs in treating depression. The third category, as we think about patient-facing digital health, is medication adherence. And these are tools that help patients comply with their medication regimens. In terms of an example, a company called Proteus has developed microsensors that can be embedded in pills and then swallowed. These ingestibles then make it possible to track when a pill has actually been taken. Proteus can be used to track cancer patients who are taking chemotherapy at home. It's particularly useful to track the compliance of people who are in quarantine and may have conditions such as diabetes or hypertension or even mental health issues. And the fourth and final category of patient-facing digital health solutions is virtual patient care, which is the delivery of care outside of the hospital or clinic that happens virtually. And because of the coronavirus, the first line of care is actually becoming digital in many places. So everyone's talking about telehealth these days, particularly about virtual visits. And virtual visits can really transform the delivery of care, allowing for contactless encounters between doctors and patients. Traditionally and historically, telehealth really has been hampered by regulations, reimbursement, questions around workflow. But COVID-19 has been catalytic in moving many providers forward in their offering of digital health. And telehealth vendors are actually reporting a 3,000% increase in telehealth visits. And we're anticipating there could be 1 billion telehealth visits in the US this year. I would say the telehealth genie is out of the bottle, and I very much hope that's where it stays. In the future, there may be hologram house calls where your doctor shows up virtually in 3 dimensions to talk to you at home. And again, this is a perfect social distance way to see your doctor. So in conclusion, I would say that digital health is one of the most talked about topics in healthcare today. And I've shared with you a working definition of digital health and my 4-part framework for thinking about how to organize this exploding field. I hope you agree with me that digital health is remarkably exciting and has great potential to help us. I think we'll be taking questions at the end. So here's my contact information if you want to reach me otherwise, including my Twitter handle where I tweet frequently. And I'll turn it back over now to Jessica.
Well, thank you very much. I'm going to share a little bit and then open it up for our Q&A and the chat. So I, as I said before, I'm a partner at Echo Health Ventures. You can see the backgrounds and boards I'm on, et cetera, on my LinkedIn profile, or go to the Echo Health Ventures website to really look at the portfolio we've invested in. Echo Health Ventures, we invest on behalf of Blue Cross of North Carolina, as well as Cambia. Both of those are payers in the Blue system, and 2 of the most innovative payers out there in terms of adopting consumer and value-based care structures. So, one more thing about Echo, we are stage agnostic investors. We typically invest, from seed all the way up through later stage companies, typically between 5 and 15 million of check size, lead, co-lead. So I spend my days here in pitches, serving on boards, evaluating markets, doing, and spending a lot of time right now trying to read the tea leaves along with everybody else. And there's a lot of noise in the market right now. And to tell you the truth, we're not expecting much data to be able to drive the way. Private industry, typically, private funding events typically lag 3 to 4 quarters in terms of being able to really understand what's going on in the market. We have this is partly because we've been in a bubble, what I would call a bubble for quite a while. We're really due for a slowdown. The digital health sector has been record pace after record pace for the last 5 years. And sometimes entrepreneurs forget there's only so many payers out there to buy the digital health for their patients and their members, and only so many providers out there that are willing to accept that new innovation. And so we have seen a glut of companies come out there. We're going to see consolidation, and we're going to see a bit of a slowdown, most likely coming. I, as I said, invest on behalf of payers. I really, I find that the exact right place to be in healthcare, because we're looking through everything through the lens of follow the money. Vinit, you showed a slide about the government doing 30% of writing checks. It's usually, if you're doing it involving veterans care and things like that, it's get up to 50%. And so we spend a lot of time watching what are the person who's actually writing the check, which is very rarely the consumer, very usually a payer or a provider system that's taking risk. So I talked a little bit about bubble, potential slowdown, a glut of companies that are out there already. But overall, investors want to invest in the healthcare space. It is the fundamentals of the healthcare market are attractive. There's, as Naomi said, the fundamental changes of how digital health is coming to market, the new platforms that are coming are very exciting, and we're seeing very rampant, obviously sad, but rampant growth, the scale and speed of which we've never seen before in the healthcare market or any market, but very difficult to predict with the record high volatility, in the shocks that are hitting the system. So happy to take Q&A on further trends within the venture capital sector, which is my field, or across the board. So I'll turn it over to Vinit to facilitate.
Thanks, Jessica. So the question's rolling in, but I have a question for you. What were your last two investments?
So the I'm going through this because I have to remember which ones are announced. Mm-hmm. So we're very active right now. Okay. And I will say that as a fund, we are, over the last 10 weeks, we'll have funded between 5 to 10 companies, rolling and continuing to do more. A lot of those are internal financings, but it's a very active time. The investment recently led Abacus, as I'm on the board of that company, was funded last year. Or a little bit before last year. It is a company, it's a data platform as a service. And then Genome Medical. Genome Medical brings genomics to everyday care. Both of them have great tailwinds in this sector, as large institutionals are often build versus buy. They tend to do the buy. And then in Genome Medical, it's a telemedicine in the genomic space. Awesome.
And Naomi, you talked about telehealth towards the end of your presentation. We've always talked about telehealth. It's been around for years. I can't tell you how many companies I've advised in that area. What has changed and what's causing this rapid adoption?
Yeah, so telehealth is not a new field. You're right, it's been around for a long time. And originally people were very worried about whether the technology worked or whether patients would like the idea. But really, as a result of COVID-19, things have changed a lot. I actually have been advocating and started the telehealth strategy at Kaiser Permanente many years ago. That's certainly picked up now. But I think historically, the challenges around telehealth have been reimbursement, regulation, reimbursement, and workflow. And COVID-19 has changed the landscape tremendously in terms of regulation, where traditionally it's been hard to practice telehealth across state lines. There's been issues about licensure. Well, that's all basically on hold, maybe even permanently off. There's been a host of blanket waivers issued by the government allowing providers to move forward with telehealth. And the government's even expanded what it will cover and what are the list of approved telehealth to include providers who are in physical therapy, occupational therapists, all sorts of folks who traditionally couldn't get reimbursed for telehealth. And reimbursement has improved a lot. There are new reimbursement codes that are available now. Telehealth is being reimbursed at parity with in-person visits, which is huge. And even telephonic visits are now getting reimbursed, and that didn't happen before. And hospitals are also allowed now to do their outpatient visits via telehealth. So reimbursement has opened up tremendously. And I would say workflow also has changed. You know, today doctors are really motivated to keep their distance from patients, both socially and physically distanced. So this has become a very appealing way for doctors to provide care, particularly specialists. For many of them, this is the only way to provide care right now. When I was the Chief Innovation Officer at Boston Children's Hospital 7 years ago, we started a teledermatology program, and it did okay, but teledermatology had not really taken off broadly. Last month, my dermatologist called me and offered me a telehealth visit, which I thought was just great. So it's wonderful to see that the doctors now really are recognizing that this is a valuable tool in their arsenal. I think, you know, telehealth is being piloted and pulled forward, and people are driving toward adoption in ways that haven't been seen before because of the pandemic. And I think it's a real silver lining. There's not a lot of good things you can say about COVID-19, but one of them is that telehealth is now something that people understand and appreciate.
Yeah, no doubt. I mean, I have a doctor's appointment tomorrow, and my doctor reached out. He's been social distancing on the Cape for the last 2 months. And so we're having a visit, my annual visit over telehealth. Jessica, what other digital health therapies or diagnostics are being reimbursed versus being out of pocket?
Yeah, I think actually we hit almost all of them. It is, you know, we're looking for parity. I think behavioral health parity came a number of years ago that really kicked off a whole, that it's supposed to be paid with behavioral health and medical health are supposed to be paid. Again, we'll just call it parity. It's not quite parity, but what we're starting to see now is the reimbursement codes have often been there and not used. But now we're starting to see Medicare come out with remote patient monitoring for chronic care, and that these are bundled reimbursements that allow a physician or provider to get at least some of their time back for the in-between checks. And I think it's not just the reimbursement, it's how we're looking at bundled care, it's how we're looking at shared savings that enable some of this to happen. I would say though, a entrepreneur coming to really come and build a company just saving money and just providing cost savings and just outcomes is challenging, especially right now in a cost-cutting time period. Being able to show top-line growth, being able to show revenue from this drive is I think, extremely important.
Yeah, that's really great. You know, there are sort of a couple of questions around, you know, getting new therapies to market, regulatory. You know, what has changed in this COVID environment? Are we accelerating FDA approval of new digital therapies? I know that new rules have been created by the FDA around digital therapies, but you know, just broadly that topic. Naomi, maybe you could start us off on that.
Yeah, so I think the FDA has really been very supportive of digital health therapies and the importance of getting FDA approval. And particularly under Scott Gottlieb, he really moved the ball forward when he was head of the FDA. And there's a channel, a pathway for digital solutions to get FDA approval. And one of the first things that happens is you look at whether you are a solution that really does require FDA approval, which there are things that touch the patient, that impact how medication is delivered, or maybe you're on the other extreme, in which case you're a health and wellness app and really you don't need to go to the FDA. And then they recognize that there's a gray area where companies have the option of working with the FDA. And there's been a lot of, not regulations, but information helping companies to figure out where they fit in and what to expect. And I advise a couple digital health companies, and I'm really encouraging them, if they are a digital diagnostic, if they're a digiceutical, they should really try to get FDA approval, because that really changes the game. Because when you go to the FDA, they still want to verify that you're safe and that you're effective, and they will require real data. They'll require the ability to see the impact that you have on patients and whether you actually can make the claims that you're making. So
yeah, there's no doubt. I mean, we launched a company out of BU called Constant Therapy for cognitive therapy for stroke and TBI patients. And we did a direct-to-consumer play, and pretty successful. I mean, we had, we had about 5,000 physical therapists and occupational therapists offering it, and speech therapists offering it up. And then we had about 30,000 patients, so many of them who paid. But, we decided to make the switch to going and getting FDA approval and looking for reimbursement. We just didn't get the kind of uptake that we thought we would. And that sort of brings to another question here. My son had started a nutrition app company that got acquired by, one of these well-funded wellness companies, in his case, Pongo. And now he's working on a chronic pain management app. So this whole wellness space, I've learned a bit of it vicariously through him. But how do you think about these new primary care people like Omada, Livongo, or Iora here in Boston? How do you guys think about that?
It's, I think, when we talk about getting the FDA pathway, but then you also need to get the coverage pathway. Right. And what is a payer actually willing to, and I think a lot of, I'm going to get to your question, but a lot of entrepreneurs actually need to be collecting not only the clinical outcomes, but the financial outcomes from the beginning. And it's really important when you present in front of a payer to be able to show that you can clinically help, but also that the cost effectiveness of the solution also. And that's really where places like Livongo and Omada can shine, is that per employee, per member, per month, they can have great cost savings. Now, it's a pretty different model than an Iora. Iora is a fundamental different way of risk taking, in which it's a standalone practice taking Medicare risk and taking that for an entire population. And then they buy those sorts of situations, those types of tools to pass on to their members. But in terms of those digital health solutions, yes, we continue to look at them. Again, I would just come back to making sure that it's not, that there's really from day one, the cost, the impact, the safety, et cetera, is all being collected, not just a, hey, this is cool, let's buy this. And so that's should it go to Goop or should it go to, the FDA? There's a definite, Goop is a Gwyneth Paltrow website. It's really about beauty and wellness. And there is a line of what's clinical and what's beauty and wellness. And yeah, it gets a little fuzzy, but they are two different markets and they're regulated differently.
I would just add,
supplements are a multi-billion-dollar market that follow that line, right, Naomi?
Yeah, I just wanted to add on to Jessica's very good point about the importance of collecting financial impact. So in Europe, if you're going for approval through the EMA, and particularly if you want to get approval in Germany, you can get approval clinically, but then they have to see the financial impact if they're going to fund it. So I think, companies today need to be thinking really about data, about clinical data, about financial data, and about just demonstrating that things work. We've moved beyond the sort of excitement and noise that we had when digital health was sort of first born in the industry. And now we're really starting to focus on what can have an impact, and people want to see results.
So I'm curious, of your 4 areas, other than telehealth, what other trends are you seeing that are growing faster? I don't want all of them, just like...
Yeah. So I think the next fastest growing, I would say, is the clinical grade digital information for diagnostic purposes. There are a lot of really interesting companies in this area, and they are going to the FDA Another company I'm involved with is called NQ Medical, and they have an algorithm for diagnosing Parkinson's based on people's typing patterns. So, yes. NQ Medical, exactly. And, you know, they have collected tons of information. They are going to the FDA, just as ResApp is. And I think it's really exciting, the types of diagnostic tools that are being built that can live and work on our mobile phones that we can carry with us. So I think that's really a huge area. I think digiceuticals are really exciting, but I think they're a lot smaller than the diagnostics.
I was remiss to mention that I too am a manager of a seed fund in life sciences that I co-manage with Mass Life Sciences. And so that's why I pulled the Incube. We do get lots of pitches from digital health companies and others. This is not just digital health, it's everything. So Jessica, there've been a couple of questions about your fund. How big is it? Mm-hmm. Do you guys, you know, a lot of funds don't like first-time entrepreneurs. Do you like first-time entrepreneurs?
Okay, those are two very different questions.
Yes.
So as we are a strategic we invest, as I said, between 5 and 15 and around. We can go down to about 2. Why that doesn't give an exact size of a fund, we invest off through evergreen capabilities in our fund. We're expecting to invest in multiple new companies this year, next year, and the year after that, and the year after that. And so I can give you, you know, the size of that investment that we're really typically looking at. Second, I think I personally backed multiple first-time entrepreneurs. But what I really look for in those first-time entrepreneurs is their proven ability to hire. I think that's one thing that multiple CEOs learn over time, how to hire people better than them in the financials, in the presentation, in the sales, in the medical, everything very, very quickly. And first-time CEOs often doubt themselves a little bit more in terms of their ability to hire those people, maybe make a few more hiring mistakes. And so that's, if I can see that path of not just hiring their friends, of really bringing in some diverse thinking, people who are better than them, and again, lots more experience, that gives me a lot more confidence in my backing of a first-time entrepreneur.
Yeah, no doubt. You know, one of the programs we run at MTTC, at Mass Tech Transfer Center, is a platform that connects academic spin-outs with entrepreneurial champions. Mm-hmm. Yeah. Because I'm a real believer in sort of bringing, you need both the science and the business, and they're equal at these early stages. And I sometimes
science out.
Yeah,
you can argue equal. Yeah, you can.
Yeah, well, I think for deep tech they're very important. Digital health maybe less so, but definitely for deep tech. And it's sometimes hard for me to convince, especially, you know, the ones coming out of MIT and Harvard, that they should think about not being the CEO the first time. But
there's a if they've shown over their career the ability to hire and execute and fire people, then definitely. But first time with only grad school, it's harder.
Yeah, no question. And Naomi, there was a question about how you measure financial impact. So you were saying that in Germany, they're looking at more than efficacy also includes financial impact. When you say financial impact, do you mean the cost to the healthcare system?
Yeah, what is the benefit to the system? How are you saving money for, you know, their governments, and so they don't have, you know, private payer system like we have. So there's a lot of different models, you know, and I think digiceuticals are particularly interesting. There are those where people are going and trying to get reimbursement from the payers. I'm thinking about tools like Pear Therapeutic that has solutions to support people who are trying to recover from addiction. But there's other digiceuticals like Akili Labs, which has a game for kids who have attention deficit disorder. And that's really, I think, more of a direct to participant play. So the key is figuring out where the value is in terms of figuring out who can pay for it. But I think most digital health companies recognize they're probably going to want to work with the payers. Certainly if you're a diagnostic tool, most likely you want this in the hands of doctors and doctors using it. So digital health, has to participate in the broader reimbursement ecosystem. What's interesting is telehealth, which is really sort of a paradigm shift, but even where they're offering, potentially a more convenient, more efficient way of delivering care, have really had to fight to get reimbursement. So it's not an easy activity for new digital health startups.
Got it. Lots of questions around, aspiring entrepreneurs and areas they're looking for. But, these are the usual questions I see in these panels, and I do a lot of these panels. There's kind of this generic question that I'm going to pose to both of you. And I'm going to do it in rapid fire. So, Jessica, you said that you had a lot of deals that are going to happen soon. What areas would you like to see being addressed by entrepreneurs in the second half of this year?
Yeah, great. A lot of those deals are really going to companies positioned to succeed already, and it's to give them war chests. It's to give them the ability to go after markets in the expanding markets in the near term. What I would like, what I'm not seeing in the market is kind of a rapid shift for the turn to affordability. I think as we move forward, the financial ability to pay for providers, for patients, is going to be really challenged over the next 3 to 5 years, potentially, definitely next 2 to 4. And so looking for affordable retail solutions, affordable, because there's going to be more out of pocket, there's going to be more people on Medicaid and the reimbursement rates of Medicaid. And so I think we've talked about cost a lot today, but I would really push entrepreneurs. I think what I'm not seeing enough of is the, hey, in times of crisis, these are some options to lower costs, and these are opportunities. I'm also not seeing probably enough entrepreneurs talk about access and equities. It's still very couched in the social drivers of health, which is so important. But it's not just, addressing social drivers of health in every form of how we bring healthcare to market. Again, that talks about affordability, but also talks about access. It talks about if you're a parent who has 2 or 3 jobs, when can you actually do that telemedicine visit in privacy? How can you make that accessible for them? And having a little bit more, I would just say, sensitivity to some of how, healthcare isn't practiced in Cambridge, but healthcare is practiced in, outside of Oklahoma City by single parents who have 2 or 3 jobs. That's the type of deal that I think is really going to potentially get legs in the next few years.
That's great. And Naomi, you're out there consulting for people. Where are you the most in demand? In what areas of consulting?
So I do a lot of work with pharma around digital health strategy and also innovation program design, how pharma can actually reach the entrepreneurs, how can they find out what's happening in the digital health ecosystem and not sort of be an impenetrable fortress, because the truth of the matter is pharma recognizes that digital health will really transform their business, that they'll be providing drugs and digital solutions in the future, that there's going to be a much bigger bucket of value that they can deliver to patients if it's not just a molecule. But the question is, how do they find those great solutions? Because they're not going to build most of them themselves. They're going to partner. And so I do a lot of work advising pharmaceutical companies on how to make those connections. And my advice to startups, when you do get your chance in front of big pharma, make sure you tell the story about what you can do for them, because that's often the piece that I hear that's missing in those pitches.
That's fantastic. So I'm going to take the moderator's prerogative to say the last remarks, since there's about a minute left. So, you saw from the patents that a lot of the patents that were being filed were around diagnosis and prognosis. And a lot of those in AI, in diagnosis and prognosis, those depend on data. And, as we know, there's massive amount of growth in data collection around healthcare. There's some of the biggest databases around are in healthcare. And so, there is a question on this too from the audience. This data generally comes in unstructured form. And I think there's going to be enormous opportunity for companies that do nothing but take this unstructured data and make it available to, machine learning and other engines. A lot of it's being done manually today. So you've got, millions of workers all over China and India who are sort of clicking on images and things like that to train these algorithms. But I think there's going to be a real opportunity to find ways to automate that. So I think our time is up. I'm getting the yank signal. I want to thank both of you, Naomi and Jessica. It's been delightful to meet both of you, and to be on this incredibly bright background with you both. So have a wonderful summer, everybody.
Thank you so much for a great discussion. It was fabulous. We had 100 people in this room, so thank you so much for spreading the knowledge, sharing your insights with everyone. Our next session coming up is digital health in Japanese market. So let's fly to the other continent and see what digital health brings over in Japan. That session is starting at 3 p.m. and I have put the link to it in the chat. If you have a second, please visit the link I also put in the chat to let us know what you thought about the session. It's a one-question survey, but it's really important to us. And I am going to share my screen very quickly with a QR code. If you could please just hover your phone over the QR code and let us know what you thought. And with this, thank you so much. It was wonderful having you all here.
Thank you, Leo.
Thank you.
Thank you. Bye.
Bye.